In 2006, a critical link was added to healthcare education in the Rochester community with the opening of the Wegmans School of Pharmacy at St. John Fisher College. Beginning with an inaugural class of 55 students, the school now houses 300 students, and by this May will have graduated over 225 pharmacists. Coming up, you'll meet the founding dean of the Wegmans School of Pharmacy and find out more about what it takes to train these healthcare professionals. Stay with us. Hello, and welcome to our community forum. I'm Dr. Lauren Vicker of the Communication Journalism Department here at St. John Fisher College. And joining me today in the studio of Cardinal Television is Dr. Scott Swigart, the Dean of the Wegmans School of Pharmacy. Welcome, and thank you so much for joining us today.
Thank you for having me.
Oh,
I'm excited about being here.
That's great. I've been looking forward to talking to you for a while.
Good.
As you know, I've had the opportunity to teach some pharmacy as well as pre-pharmacy students in my public speaking class. And one thing that I hear over and over is that their decision to attend pharmacy school was based on hearing you speak at an information session. So what do you tell them? Why is this such a great career?
Well, I'll tell you, probably because, and I tell the students, you know, I am a pharmacist also, and I love the profession of pharmacy, and I'm excited about it, and I think they sense that, my excitement for the School of Pharmacy. But it is a great profession, and one of the things, and I always tell my students this too, is that there are so many opportunities in pharmacy. So you get your pharmacy degree and become a licensed pharmacist, and there's so many different areas that you can practice in, you know, from the traditional community setting to a hospital setting to research to academia to nuclear pharmacy to veterinary pharmacy to compounding pharmacy. There are just so many different opportunities that you could choose to work in, and so anybody could find a good fit to work.
But what kind of a person makes a good pharmacist?
Yeah.
One of my students, I have to tell you, one of my students said that she really liked healthcare, but she didn't like blood, so she thought maybe pharmacy for her.
And not a bad choice, that is. And in most places, most areas of pharmacy practice, you don't have to deal with blood. So, but there are some that you would. I think the key ingredients in those students looking to go into pharmacy is you have to have an analytical mind, enjoy solving puzzles and figuring things out. So that really helps especially in the educational process, having that inquisitive mind. I think good math skills, good math and science skills are an absolute essential ingredient. If you don't like chemistry, don't go into pharmacy. So you have to have good solid math skills and chemistry skills and like that problem solving. But in addition to that, and probably most importantly, is you've got to love people. You got to you want to help people. You know, our profession, I mean, we deal with people all day long. We interact with our patients, and so you've got to have that love and desire to help people.
Okay, that sounds great. Now, I think a lot of people are surprised to hear that this is actually a doctoral program, because unlike a lot of other healthcare professionals, most people know their retail pharmacist by his or her first name. So could you tell us a little bit about what the program is like?
Yeah, actually we made the transition to the Doctor of Pharmacy degree as the only licensable degree it's been about 12 years now. So about 2000 is when the change came. Some of it came around, even back in 2000, you were looking at the average, most commonly it was at least 5 years, which seemed too long for a baccalaureate degree. You know, not long enough for other degrees, for an advanced degree. But then as we started making the transition in our roles, our pharmacist roles, as they became more clinical and more patient interaction, and the pharmacists became more involved in the outcomes of drug therapy, we started expanding the curriculum and adding a clinical portion. And so today our students do an entire year of experiential clinical training in addition So the length of time to graduation has become a minimum of 6 years. Most students, it's usually 7 or 8 years. So that's when the transition to the Doctor of Pharmacy degree came about, to better reflect the education that they were receiving, as well as the roles and abilities that pharmacists aspire to.
And the actual pharmacy program is 4 years, correct?
Correct. So our curriculum is 4 years. Our students, obviously we have very specific prerequisite requirements that they need to complete before they enter into pharmacy school. You can do that in 2 years. It's a really tight, I mean, we require over 60 hours of specific courses, so you can complete it in 2 years, so you can complete the degree in 6 years. But I would say 85% of my students come in with 3 or more years.
Okay.
So the majority are taking more than 2 years to complete their prerequisites before. And it doesn't matter how many years of prerequisites you have. Once you enter pharmacy, it's going to be 4 years.
Once you get into the
program, right?
The actual program. Okay. So how much of that time are they spending in the classroom, in labs, at clinical sites?
The first 3 years of the curriculum are didactic. Now we do have, and then the 4th year is clinical, so all clinical. So they're not in the classroom at all in the 4th year. Now we do have what we call introductory practice experiences. So in the 2nd and 3rd year, so during that those didactic years, they do short-term clinical rotations here in the area. But so the first 3 years, as I mentioned, are essentially didactic classroom. We do have lab courses incorporated into that. We do a fair amount of small group activities, especially when they get into their 2nd and 3rd year, when we're starting to work on communication skills for counseling patients. But then a lot of case presentations and and working through problems and drug therapy problems. So we do a lot of small group activities with them through the first 3 years. Then in their 4th year, in fact, they're going to do actually 7 6-week rotations that are full-time. They're 40 hours a week, 4 weeks a month, or for 6 weeks. That's full-time in a clinical site. So they do, in their time with us, they do about 1,800 hours of intern hours that count towards their requirement for licensure.
Wow, that's a lot of hours of experience, yeah.
Yes, but again, in a practical doctorate, the experience is essential. So we want our students in the role where they're seeing patients and they're understanding the complexities of drug therapy and understanding how to work through them. So when they become pharmacists and they're on their own, they know how to handle it. And I'll tell you, there is this real realization for a pharmacist. The first time, I still remember it. It was 30 years ago, over 30 years ago. And I still remember it, the first time you find yourself in that pharmacy as the only licensed pharmacist. And you go, oh my gosh, it's on me.
Wow, yeah.
So,
yeah, that's a lot of responsibility.
It is.
Definitely a lot of responsibility. So we mentioned in the introduction that you were the founding dean of the Wegmans School of Pharmacy. So what did that entail? I remember you being on campus well before the building was done.
Yeah. First of all, I'll tell you, it absolutely the most favorite thing I've done in my professional career. So it was a real pleasure, and it was a lot of work. So yeah, and I was here a little over a year before we started our first class, and there's a number of things that go into planning it. And honestly, the easiest part was the curriculum. I'd been teaching pharmacy for 20 years before that, and I knew what was in a pharmacy curriculum, and I knew what courses had to be there, and what content needed to be there, and how many experiential sites we needed. But and so that was the easy part. The difficult part was really hiring faculty.
Right, yeah.
So so when I started, I mean, I was the only person in the School of Pharmacy. And now, 7 years later, we have 35 faculty and 6 support staff. So, I mean, that growth through those years. A lot of it was the planning process, though. Like, I had a hiring plan that I created. So, I mean, we hired our first, the plan included about a 5-year hiring plan where we were adding faculty each year over those 5 years.
Because you just needed faculty for the first year
and then the second year.
Right.
Right. Okay. And you had to be a little bit ahead of time. Like, we had a number of our practice faculty in before we got to the 4th year because they had to develop the clinical rotations and the advanced practice rotations. So there was a fair amount of planning in the process. And then the other big thing was accreditation.
Right.
So as all the professional schools, we have an accrediting body. And there's one single accrediting body. ACPE is the accrediting body for pharmacy. And so there's a pretty rigorous process, especially for a new school. I had site visits. In the first 5 years, I had 4 site visits. So where a group from the accrediting body, as well as faculty from other schools on an accreditation visit, would come to campus and examine what you're doing and how you're putting everything to do. And it's like taking a test. So it's stressful, but as I said, in the first 5 years, we had 4 site visits. So to make sure that we were accomplishing what we said we were going to accomplish and doing it in a timely fashion, and that everything was in place. And the accrediting body, and they do that they're really there to protect the students. I'm advertising and recruiting students to become pharmacists, and so they want to make sure that I'm going to prepare them appropriately, and that they will be licensable and then marketable and get jobs. So they're there to protect the students. And so all along the process, each year through until we graduated our first class, there are several steps in the accreditation process. The first being what's called pre-candidate status. So that's before you have any students. And so they're pretty much looking at your plan. So I've created this plan that included the hiring plan and everything else. And then the accrediting body will approve your plan and give you a pre-candidate status. And then you're eligible to admit your first class. And then once your first class gets here, then during that first year of the first class, they come in and visit.
Right away, huh?
Right away, to make sure that you're doing what you said you were going to do. And then at that point, you would become what's called candidate status. Now, candidate status schools have all the rights and privileges of a fully accredited school. But you hadn't graduated your first class yet, so you're not eligible for full accreditation. But that enables our students to license, because in order to license, they have to graduate from an accredited school. And so candidate status is considered an accredited status. So then they come back one more time just to, for a candidate visit. And then they come back the last year. When you graduate your first class, they come back, and then you're eligible for full accreditation. And then, of course, the first full accreditation is only for 2 years. So they come back, yes.
Wow, never ending.
Never ending. Yeah. But now we're fully accredited to have received 5 years of accreditation. So we have a few years before they're going to visit again.
So accrediting was a really big deal, and I assume they want some kind of standard across schools.
Correct.
Does that mean that every pharmacy program is exactly the same, or are there things that differentiate them? And
no, far from it, actually. There are some consistencies. The content of the material is similar. And again, there are standards that dictate what needs to be in the curriculum. But how it's delivered is probably as different as there are as many pharmacy schools. So there is some uniquenesses to almost all the programs. And actually, our accrediting body really encourages that.
So what makes Fisher unique, or what is our brand?
Yeah, the Fisher pharmacists.
Okay.
And, one of the good, we've got 3 graduating classes now, and one of the things I really enjoy most is talking to employers that have hired my students, because I do think that there's something unique about our students. And I think, as we created our curriculum and created our program here, we really put an emphasis on the practitioner. We want to create the best practitioners possible, and we've really done that by really integrating this practice. I talked about the introductory practice experiences leading into the advanced practice experiences, and really working with our students on professionalism. Yes. So we have really integrated that into all of our educational process. I'm sure you've noticed on campus, our students have a dress code.
Yes, they do. Yeah.
Not extensive. I mean, it's not, well, I didn't have a dress code, but back in the, it's not shirt and tie and jacket. But it's still, we used, actually we got a dress code from several of the pharmacies, and we created and modeled our dress code for our students around the dress code for these pharmacies. And but see, that's a part of it, and of that professionalization. And I tell the students the day, in fact, the first day of orientation, right before classes start for first-year students, I stand in front of them and welcome them to the profession. And because they've entered my profession, and they're a part of my profession. So so we have really worked on that professionalism part. I had one of my employers, and we have a career day once a year, and they said, I want to take a picture of your career day. She said, I've never seen, your students are so well dressed, so well prepared. Their CVs are excellent. And I was shocked. I said, well, yes. I mean, we've trained our students for this. So it's that professionalism and practice. But the way we do it is what's really unique. And that's, we are so student-centered in our approach. During the summers when I have our faculty retreats, I always talk to them about my vision. And so they hear it almost every year. They get but when the first thing in my vision, and again, I wrote this when I started here before I had any students or faculty, was that students are our highest priority, and the success of our students is our most treasured thing. And there's no reason for all of our students not to be successful. That's my goal every year, is that every student is successful. And so we have a real commitment to the success of our students. And so we, the faculty-student interactions, the faculty are there to help our students be successful. I see a lot of places that say they're student-centered, but you can ask the students, what's truly student-centered.
Okay. Well, and I did want to ask you a little bit more about the students, because I was surprised to find not only did they come from all over the United States, but all over the world. I had students from countries in Africa and in Asia, and are you recruiting students? Are they finding us? How are they coming to us?
No, we don't recruit too much. I mean, obviously, it's been really, really good for us. Not so good for the students, but really good for us. The applicant pools in pharmacy are excellent. And so we have a significant applicant pool. But I think because we have that significant applicant pool, it gives us an opportunity to have a wider selection of students. Right. I mean, it's a very rigorous admissions process, and students have to be very well qualified. But we have some really great students that are very qualified. So it's given us the opportunity to have a lot of diversity, not just other states, but also other countries. Yeah. And so it has given us the opportunity to be able to become a little more diverse in our student populations. And it adds so much value. I love watching our students, as I mentioned, we do a lot of small group activities, and the students do a lot of small group that isn't assigned. Right. So, they study together as a small group. They, you can come to the pharmacy building at, midnight, and there you'll find groups of students in the school studying together. And it's so much fun to watch the dynamics of these small groups, and especially with people that come from all corners of the world working together. So it's really a great environment.
Yeah, that does sound like it's good experience for them to be in a diverse culture too. So now you mentioned that they come from different academic backgrounds, so that students could enter the program after only 2 years as an undergraduate, or 3, or complete. Do students who come in early, do you think they're at a disadvantage in the program?
No, I don't think they're at a disadvantage. I mean, academically, they've had to achieve, and so they're very good quality students. So academically, I don't see a real difference in their academic outcomes between the younger groups. I think there's a sense, a better sense, as you're a few years older, you have a little more sense of taking care of patients and interacting with older adults. And when you look at it, I mean, the over 65 group is a significant population for pharmacies. So being able to relate and interact with the little more maturity tends to help.
So now, do most of the students come directly from an undergraduate program, or do you have a percentage who've worked either, in other fields and then come to pharmacy school?
We have a significant number of students that are second career students. So who have worked out, teachers and other professions that have had to come back and took their pharmacy prerequisites, and then came to pharmacy school. So we do have a fair number. I mean, I would say that I have. Actually, I think my oldest student was 50 when they started.
Really?
But so I do have some students that are definitely second career students. I would say only probably the majority of our students, though, have come through the normal track, and have completed their prerequisites in 2 to 3 to 4 years on a pretty typical track, and then came into pharmacy school. That's the majority. But I do have, and again, it adds to the diversity of my student body. And again, you see that same interaction, especially in small group activities. And you've got the energy of the younger student and the maturity of the more mature student.
The adult student.
The adult student.
The adult student, yes. We like to have our adult students in class. So now, early in this discussion, you mentioned that there are so many jobs that a pharmacist can do, and I think maybe the average person only thinks of the retail pharmacist. That's the only experience they have. So could you talk a little bit about some of those career choices that students might have?
And you're absolutely right. I mean, we see the man or woman behind that counter. And a few years ago, they used to be elevated and behind that big glass. In the white coat. And that's been our perception of pharmacy. And but as I mentioned, there are a lot of other opportunities for students, for pharmacists to go into. Obviously, hospital is probably the second most common area of practice. So, and by the way, the community or retail setting is still the most common employer of our graduates and of pharmacists. And hospital is probably second. So, institutional practice is slightly different, and so the distribution system to medications are different. Your interaction with patients are different, but it's. In fact, I used to. And my first practice experience was in a hospital. I used to think it was easier because our patients couldn't get away. They were stuck in their bed, so it was easier. But so hospital practice is a little bit different, but there are some really unique settings. I would tell you when I started pharmacy school, and so I knew when I went into it, I knew I was going to be a nuclear pharmacist. Then when I got into my junior and senior year of pharmacy school and started and did my practice experiences, I hated it. I didn't like it, so I went another direction. But nuclear pharmacy is an area of pharmacy where there's a number of both clinical but mostly diagnostic agents that are radioactive or radio tracers, and those have to be prepared. And so it's, anytime a pharmaceutical is prepared, it's almost always done by a pharmacist. And obviously that required a lot of special technique. And
so that's a specialization all by itself.
All by itself, yeah. Okay. Then you have just about as many medical subspecialties as there are. You have areas for pharmacists to practice. In fact, what I went into, now I did a postgraduate residency training, and I did that in pediatrics. And so that was the area I practiced in. So, so you can do a subspecialty in cardiology and endocrinology, diabetes. You could do it in, as I mentioned, pediatrics, psychiatry. So a lot of the medical subspecialties have special areas for pharmacists. As I mentioned, compounding pharmacies are a real common thing now. And so it's, again, an art of pharmacy. So it takes some specialized knowledge and training and to practice in that area. You have veterinary pharmacy. All our pets and animals all take medications also. Oncology. I mean, there's a lot of subspecialty areas available. And then there's the research route. And so a lot of pharmacists go into research and drug companies, working for a pharmaceutical manufacturer, and in fact, just about all the roles. I know pharmacists that are in the research, but also in the manufacturing aspects of pharmaceuticals at a pharmaceutical company. And then you have, of course, the most exciting of all the fields, which would be academia.
Of course.
So you get to shape and mold the lives
of next generation pharmacists. Exactly. So we're just about out of time. I wonder if you could just tell us what the job outlook is like for pharmacists now.
Job market is still very good. Over the recent years, we've opened a lot of new pharmacy schools in a response to the shortage. Probably about 10 years ago, we had a pretty significant shortage of pharmacists in the country. We have responded by opening a number of new pharmacy schools, like St. John Fisher. And so the number of so the job opportunity is getting a little tighter, but still is very good. A couple of things that are influencing it. First is the baby boomers. Those over age 65 tend to take a lot more prescription than those under 65. And so as the baby boomers turn 65, their number of prescriptions are going to increase. Healthcare reform, we're going to add somewhere between 30 and 40 million people into the healthcare system that haven't been there, that are all going to need pharmaceuticals. So the job market's good.
Job market's good.
Yep.
Okay. All right. Well, with that, we need to conclude. I only have time to say thank you, Dean Scott Swigart of the Wegmans School of Pharmacy. I want to thank you for joining us today, and I hope this has been an informative session for you. For more information about the Wegmans School of Pharmacy, check out the school's website at sjfc.edu. I'm Lauren Vicker, thanking you for joining us today on our Community Forum.